Have you developed a tight cord in your armpit or your arm after lymph node surgery for breast cancer or melanoma? Many people with cording respond very well to simple exercises, but some need a little bit more help. Hi, my name is Beth Hoag. I'm a physical therapist with over 15 years of experience working in cancer rehab, lymphedema, and pelvic health. I'm also the founder of the online cancer rehab space. In this video, we're going to talk about more advanced exercises to help deal with cording after breast cancer or melanoma surgery. Now, this video is really designed for people who have already tried the simpler exercises for which I've already created a video for. So if you haven't watched that exercise, I encourage you to go back, try those exercises first, and then if that has not been enough to resolve your symptoms, come back and join us here again. I'll put the link in the description box below and also up here. So with that out of the way, let's dive in. Now, just as a quick recap about what cording is, you'll notice I tend to use the word cording and not axillary web syndrome because cording can happen in other areas other than just the armpit. So cording is really a tight rope-like structure or series of small rope-like structures that happen following surgery in the armpit where lymph nodes are removed. Typically, this is most often done after breast cancer, during breast cancer surgery and melanoma surgery cases. This happens as the body starts to naturally heal from the cording, and that cording gradually starts to tighten up over time. Most common for cording to happen no sooner than 2 weeks after surgery, but often within 2 to 6 weeks post-surgery. I have absolutely seen it happen after radiation as well, and unusually it can even happen years later, though this is much less common. And as you might recall from my other video, in addition to feeling this rope-like structure in the armpit, its most common path is down the inside of the bicep or the upper arm, into the elbow crease, down the forearm along the thumb side, and sometimes even into the wrist and the thumb. Cording can also happen in other places like underneath the breast and along the side of the chest wall as well. Remember that for many, cording can be sudden onset of pain. It can be painful and very sensitive to the touch, and sometimes there's even swelling that happens alongside this. As I mentioned in my previous video, anytime someone has been diagnosed with cancer and has pain start to happen, new episodes of pain, this can be really frightening and scary. I really do encourage you to reach out to a family physician if you're concerned about this or if this problem is not going away. But I really also, when I see clients in clinic, like to reassure them when I see these symptoms starting, that very, very likely this pain and this swelling, if it's happening, is because of the cording that's begun. So let's talk about a few more advanced exercises that are beyond that simple flossing routine that I gave you in my other video. Now, before we dive into these exercises, as you'll notice with any of my videos that go through movement and exercise, I believe very strongly in the body-mind connection, and the science backs this up. So as we go through these exercises, I want to encourage you to make this you time, not a time where you're multitasking or doing other things at the same time or thinking about a million things at the same time. I encourage you to take this time for you, to be aware of what's going on in your body. I believe strongly in understanding the whys through videos like this. And without understanding and being aware, it's impossible to notice positive changes in your body as we move forward with this. In addition, I also encourage you to be very aware of your breath. Deep breathing is a really important portion of working through cording because the cording can often get tethered into the ribs in the armpit. So by using the rib motion via your breath, it's like the secret sauce or the cherry on top to some of these exercises. Finally, the last piece is how frequently do you do the exercises that we're about to go through. Typically, I recommend holding things for about a minute to a minute and a half. That often works out to be about 10 to 15, we'll say, deep, slow, diaphragmatic breaths. Or if you're the type of person that really wants the timer on, I encourage you to set the timer on your phone or your watch so that you can really be true to the time. Many people think that 2 minutes or a minute and a half is only 20 seconds, but I assure you it's a lot longer so that the timer can keep you pretty honest. So the first stretch we're going to do is lying near the edge of your bed. Now I have a pretty narrow bed here, so I'm going to scoot over a little bit. So what I'm going to encourage you to do on the affected side, you're going to slide that arm up like a snow angel to the point where you feel some sort of a mild pull occurring down the arm into the armpit or wherever you're feeling that tension. From there then, you're going to, with your fingertips, you're going to tip your fingertips down towards the ground and then bring them back up. So in case you can't see that in this video, with my elbow in that straightened position, we're doing more of an advancement of that first video that we did with that nerve flossing technique. So again, bringing the arm out to the side and doing a floss of the hand in and out. Now I do encourage you to keep your neck facing forward, your head facing forward. As we do this, as we breathe in, we're going to tip those fingertips back. And as we exhale, we're going to release. So doing it again, inhale, fingertips back. And exhale and release. So we're going to repeat that for 10 to 15 deep breaths. Now the second stretch we're going to do is a modification of stretching through this muscle here called the bicep. Ultimately, we're going for a long stretch through that whole fascial region of the cord. So what I'm going to invite you to do is get your hand on a wall, palm on the wall, facing the wall to begin with, and then we're going to step away until the elbow is straight. Now ideally we want to turn the fingertips back, but to start out I'm going to invite you to fingertips up towards the ceiling. As the elbows stay straight, we're going to start to turn our body away until you feel a little bit of a pull. The pull may be anywhere along the arm. Now this is where it's really important to take your time and go easily. Go lightly, I should say. This is a really intense stretch. So be aware of what you're feeling. Go to the edge or the barrier of the pull, but do not bash through that position. From there, we're going to hold this for 10 to 15 deep breaths and explore how that feels differently as you breathe in and out through the ribs. As this gets easier over time, you can gradually start to invite those fingertips to turn back, but let me tell you, this does get a lot more intense. So play with your hand position depending on how that feels for you in your body. The last exercise, we're going to actually start to use our hand to get into the cording. So if you remember, I talked about how the cording can tether in to the scar tissue in the ribs in the armpit. So we're going to take that hand and bring it into that snow angel position. Please make sure your whole arm is supported by the floor of your bed, not like I am in this picture exactly. Then we're going to take our fingers and find that area of the cord in the armpit. We're going to pinch it. We're going to feel around for that rope and we're going to hold on to it on either side, and then we're going to rock it back and forth. Now I want you to encourage you to be really gentle with this, as this can be a pretty tender area and you can explore different areas of the cord as you go up and down. So we're going to take some deep breaths as we do this, nice and slowly as you're rocking back and forth, being very gentle, again, being very aware of what you're feeling, not bashing through pain, finding that area that feels a little tight and rocking it as you hold this position for 10 to 15 deep, slow breaths. Now, a couple other things I want you to watch out for and be aware of as you do these exercises. One, it is very, very normal as you're running through them to feel a snap or a pop or sort of a release, if you will, somewhere along the line of that cording. I want to reassure you this is not dangerous, that you have not done something wrong. Quite confident that this is fascial tissue starting to release in response to the gentle loads that you're starting to place along that area of tether or cording going on. Now, indications or times where you should be reaching out to a physical therapist with experience in cancer rehab would be if after these exercises or even beyond that, you're noticing that your arm or that wherever that affected area is feeling progressively heavy, achy, or even more progressive pain, or even a gradual loss of mobility of the shoulder. These are all times where you should be getting more help. reaching out to a cancer rehab physical therapist in your area, and if that is not possible, at the very least beginning by touching base with your oncologist or your family physician. It's my experience that sometimes when these are things that are starting to happen, there's more going on, and with my clients who come to see me, we need to take a little bit more time to figure out the whys of what's going on and more of the complexity of the factors that are feeding into your individual situation. Absolutely treatable, but sometimes it just needs a little bit more help. If you enjoyed this content and would like to see more, I encourage you to give this video a big thumbs up. Subscribe to my channel, which is completely free. And if you have any questions or information that you would like to learn in future videos, I encourage you to put that in the chat box below. The greatest gift at the end of the day that you can do is to share this video with somebody else who you think could benefit from this information. At the end of the day, your quality of life matters. It really matters. Until next time, be well.